Hey everyone, I'm always checking out new research on how to support our patients that are going for IVF, in vitro fertilization, and what we can be doing to help support them, A, feel better through the process, and B, which is where most patients, show up and are curious about what we can do, is to actually improve success rates. And I love looking at alternative-based therapies in the clinical research and evidence because a lot of the time they have such a high safety profile. And so it's my passion to look at how we can safely integrate a lot of these therapies to help patients that are preparing for treatments like IVF. Now, a question that I get often from patients that are preparing for the IVF process, especially in this last year of the pandemic, is does stress have an impact on their chances of conceiving? And the answer to that question is not very straightforward, but we do have very key pieces of information on newer research that provide a very interesting understanding of what stress may be doing for fertility rates. Now, I had written a while back, if you've been following our research posts and videos, about two very specific hormones that we can test for that have been strongly associated with decreased fertility rates and increased miscarriage rates. And those two hormones were cortisol, which is a stress hormone produced by the adrenal gland, and the other hormone is prolactin, which is produced by the pituitary gland. And it is increased, in the production of prolactin increases specifically during periods of stress as well. So there was a new systematic review and meta-analysis published, and they looked at multiple trials and basically trials that were looking at how stress reduction therapies during IVF may impact pregnancy rates. And the results were quite impressive because they found that doing any one of the multiple psychosocial interventions that they had looked at in these studies, from journaling, mindfulness, meditation, and music therapy, all of these therapies were found to pretty much be associated with an increase in pregnancy rates. And the difference in pregnancy rates was found with how long patients were basically participating or engaging in some of these psychosocial interventions to help reduce stress and therefore cortisol and potentially prolactin levels. And so basically, they found that if patients were engaging in these activities for less than 15 days, it was associated with about a 12% increase in clinical pregnancy rates with IVF. Clinical pregnancy meaning they get a positive home urine test, they go for a blood test, they see that there's a positive blood test, and they have an ultrasound confirming that everything is looking okay and a heartbeat is detected. That is considered a positive clinical pregnancy. So the likelihood of that occurring after an IVF was about 12% higher for couples that engaged in any of these therapies for less than 15 days. Now, if they did this more long term, preparing for the IVF, it was longer than 15 days. Some of these studies and trials going up to, I think, as far as 10 weeks. That increase in clinical pregnancy, the chances of having a positive clinical pregnancy increased to about 21% compared to couples that didn't engage in any form of psychosocial intervention. And I think this is really cool because even though it's a correlation and not causation, we know through other studies the wonderful impact that meditation, mindfulness, music therapy, journaling can have on our mental health, emotional well-being and resilience, stress resilience, and all these things have been associated with improved immune function, increased resilience to depression, decreased likelihood of relapsing into a major depressive disorder, decreased intensity and frequency of anxiety symptoms. So to me, it's kind of like a win-win situation when we look at mindfulness-based therapies. And this is beyond, again, just meditation. Like, they had included journaling as a sole intervention in this research paper that was published recently. And so I think it's a wonderful adjunctive therapy for patients to be considering and discussing with their healthcare providers, especially if you're going for IVF, because one thing we know during IVF is if stress levels are here before the IVF process, usually jump up. So we usually see stress levels go up with IVF. There's a lot on the line emotionally, financially, and your dream of carrying to term with a healthy child and obtaining a healthy pregnancy. So there's a lot of stress associated with that. And these psychosocial interventions can help to basically combat and help mitigate that increase in stress, and may at the very least help you to feel more comfortable, relaxed, and content with a procedure you're going through, rather than feeling tense, anxious, and worried about what may happen. So this is really a wonderful research paper, because it also shows us it doesn't always have to be meditation. While I'm a big advocate for meditation and mindfulness, there's so many other therapies. So for patients that, for example, don't like meditation or haven't been able to find success practicing meditation long term, it's a really good opportunity for us to also discuss other potential interventions that were included in this research paper that can be just as beneficial in improving success rates and reducing a lot of these stress hormones like cortisol and prolactin. So as always, if you guys have any questions, drop us a message or send us a direct message, and we'll be happy to respond. All right, take care, everyone.